Like it or not, gaining weight during pregnancy is inevitable. Your baby's growth and development depends on it. But the amount of weight you gain could make a difference between a healthy pregnancy and one that's more complicated for both mother and baby. I'm Dr. Damon Cobb, OBGYN, and today we'll answer the questions most pregnant women have when it comes to weight gain and pregnancy. This is Preggy Pals, Episode 4.
Is that a plus sign?
Pink or blue? Hospital or home birth?
What type of food should I be eating?
I think I just peed myself. I'm pregnant, and I have to exercise.
What pregnancy glow?
Wait, was that a contraction?
Gotta make these pants fit. I've got kinkles.
What do you mean there's more than one?
You've got the symptoms, and now you've got the support you need for a happy 9 months. This is Preggy Pals, your pregnancy, your way. Welcome to Preggy Pals, broadcasting from the Birth Education Center of San Diego. I'm your host, Sunny Galt. Preggy Pals is all about educating moms-to-be about their choices during pregnancy and childbirth so they can make decisions that are best for their family. And the show is all about the listeners. You can visit our website at preggypals.com for more information on how you can become part of our show. You can send us comments or suggestions through the contact link on our website, or you can call the Preggy Pals hotline at 619-866-4775. Okay, let's start with our introductions. Like I said, I'm Sunny. I am 34 years old, and my due date is April 28th. The gender, we're having another little boy. This is our second son, and we are having a C-section.
Hi, my name is Rochelle DeMeo, and I teach college part-time. My due date is June 23rd, and we are having a boy. It's our second little boy, and we are planning for a vaginal birth.
Hi, I'm Cherry Christensen. I work in consumer research, and I am due on the 23rd of June. This is my first child, and we're not going to find out if it's a girl or a boy until the great reveal, and we're hoping to have an unmedicated home birth.
So can you tell us, would you prefer a boy or girl?
You know, I really don't. I really don't. But I will tell you that I had a dream the other night. It was a super, super vivid dream. It was my husband and I. We were playing in the park with two little kids. They were the same gender, and they were both little girls.
Really?
So we'll see.
I think that's in your future then, maybe,
The little girl, the image I had of the little girl was like a splitting image of me at like age 3. So yeah, they were older in this dream too. We weren't holding a baby or anything. Right. But it was kind of strange.
Well, it could be mother's intuition. You know, they say.
I haven't had any feeling one way or the other at all. So.
Well, my intuitions were wrong both times.
Yeah? Okay.
So it kind of it did work for me. Maybe it'll work for you. Okay, we'll be right back. All right, let's kick off today's episode with some unbelievable pregnancy stories making headlines around the internet. Now, all of these stories are posted on our Preggy Pals Pinterest board if you want to check them out. So you guys have probably heard of this before. I don't know if you guys watch the show Mad Men. I've actually never seen the show, but I am very familiar with January Jones, who is one of the main actresses from the show. She is getting so much flack right now for encapsulating her placenta. And obviously taking these pills to make her feel better after having a baby. And I wanted to get your guys' take on this. I'm really mad that people are just being so mean to her. I mean, they're saying stuff like it's cannibalism and how can you possibly do this? And, you know, how can this be good for you? And if this were good, that everybody would recommend it. Anyways, what are your guys' thoughts?
I mean, with my first, I didn't. We had heard shows about it and everything, but I thought it was a little pricey. And I remember the benefits of encapsulating her placenta, and I actually wanted to do it, but I thought it's a little pricey. I'm not really sure how it's going to be. But I actually had asked to save my placenta, but then we forgot it.
You forgot it at the hospital? But were they okay with that?
They were fine with it. And they actually kept it, and then like a week later, I was like, oh my gosh, that's right, because we wanted to go back and bring the nurse like some flowers and stuff because she had a really good nurse, and they were like, oh, well, after we waited a few days, and after a few days, we had to, discard it.
I'm surprised they even kept it a few days for you.
I'm surprised, too. That's amazing.
Yeah, they kept it for, I guess, 2 or 3 days, but I contacted them a week later, so it was kind of too late. But I didn't really have bad postpartum up until my son was 9 months, which is weird, because when he was first born, it was so just easy, and my hormones were just, I was on a high kind of being a new mom. And then at around 9 months, and I don't know if it's because I got pregnant again. It was around the same time.
Yeah.
So I don't know if it was because of that or if it was just post. Because I was reading also that you can get postpartum up until the first year, and it's not necessarily right away. So I don't know. But I know for about 2 weeks I did have the baby blues and was like, crap, I should have, encapsulated my placenta. Maybe it would have been better. So this time around, we're actually looking into doing it.
Yeah, because that is what they say. They say, and I haven't done this yet. We're actually going to do this time around with my son. But they do say that it's supposed to help with postpartum and then also to bring in your milk supply. Those are the two things that I hear
I've heard both of those. And it's funny because I've gone from one extreme to the other. I, probably 3 or 4 months ago had never even heard of this. And I remember reading someone post on a page on Facebook, does anyone have any recommendations for placenta encapsulation? And I was like, what is that? And then, now if you ask me about this thing on January Jones, I'm like, oh, it just seems so normal, because the second I researched it and read what it was and read what the benefits were, to me, it just seemed like, well, why wouldn't I want to do this other than the cost aside? And believe it or not, my husband and I have talked about him actually doing it himself. We have everything we need. And,
wow. You have a husband that would actually do that?
Well, that's funny you say that, because I met someone actually about a week ago. We were chatting about it, and we were talking about the cost implications. And I said, well, I think we might just do it. We might just do it ourselves. And even if I have to buy a new dehydrator, the cost is the same, and I get the dehydrator for the rest of my life. So
right.
And she was like, oh my God, my husband is so grossed out by the idea that I even want to do this that he would never. You're so lucky your husband would do this for you. I'm just thinking things are going to be a little hectic in that first 24 hours, and I might need my husband to be doing something else.
Yeah.
Other than steaming my placenta in the kitchen.
You think? But, caring for a kid?
But what amazes me actually, though, is oftentimes when I read these articles, I don't know if you guys ever actually scroll down and read the comments, because it's not so much the articles. The articles are usually written, and they may have one sway or another, but it's the comments from sort of, mainstream America that people are writing back that are saying, people who are pro it say, well, we're the only mammals that don't eat our placenta.
And that's what January Jones said in this article.
And then you have all other people, talking about, other things that, monkeys and mammals do that we don't do, that we shouldn't be doing. And
like eat our feces or something like
exactly.
that. Yeah,
they'll make stupid analogies like that. And I'm just like, if you don't want to do it, don't do it.
Exactly. The big argument is there haven't been a lot of scientific studies to prove if it really does help. And here's my take on it. If it makes you feel better, whether it's a placebo effect or not, why not do it? Who cares why you feel better? Yeah. The whole point is to feel better, right? Today on Preggy Pals, we're discussing a topic that most women wonder throughout their pregnancy. How much weight should I gain, and how quickly should I gain it? Our expert today is Dr. Damon Cobb, an OBGYN here in San Diego. Dr. Cobb, welcome to the show, and thanks for joining us.
Thank you. It's an honor to be here.
Okay, so let's get right to it. Generally speaking, how much weight should women gain during pregnancy?
That is a great question. It's a question I hear every day in the office. The Institute of Medicine in 1990 recommended a maternal weight gain between 25 and 35 pounds. But the studies that were done at that point, they were generally not high-quality studies. So they revised these recommendations in 2009, and they changed their guidelines to include biological factors, psychosocial, and behavioral characteristics. They revised their recommendations to include an upper limit of weight gain for different body types, more specifically women with greater than ideal body weight or an increased BMI, obese women, again, like I mentioned, overweight, normal weight, and underweight women as well.
So if we were to break this down, do they have specific numbers? Like, can we say, okay, if you're underweight, the current recommendation is this. If you're normal weight, it's this. How can we break that down?
Definitely. When we look at the BMI or just your pre-pregnancy weight, for obese women, total pregnancy weight gain should be between 11 and 20 pounds. Normal or overweight women whose BMI is between 25 and 29, their total weight gain should be 15 to 25 pounds. Normal weight women, their total pregnancy weight gain should be 25 to 35 pounds. And underweight, 28 to 40 pounds total.
What about guidelines for women with gestational diabetes? I'm actually falling into that category with this pregnancy. So are those numbers different, or is it still based on how much weight, was I underweight, was I overweight before I got pregnant?
And that's a great question, because most women don't even find out that they have gestational diabetes until they're 2/3 into their pregnancy anyway. Right. And who knows how much weight they'd gained up until that point?
Sure.
No, that is a great question. From a standpoint of gestational diabetes, I think that choosing your calories correctly and the type of food that you're eating is the most important. I would still base the guidelines on the numbers that we talked about before. However, choosing what you eat a little bit differently from a standpoint of controlling your blood sugars overall for your health and for baby's health.
Okay. And then what about twins or multiples? I wanted to touch on that too, because it's not necessarily just adding, twice as many pounds or 3 times as many pounds to the equation, right?
Sure. And we still base it on those recommendations. However, we alter them a little bit just because, you're carrying a couple of little ones. Again, as we mentioned, I'd just go over the obese down to the underweight women. Obesity, we would say 25 to 42 pounds total for twins. Overweight would be 31 to 50 pounds. Normal weight, 37 to 54 pounds. And underweight, there's really not any sufficient data based on that.
Okay. And obviously you need to listen to whatever your doctor's telling you, right? I mean,
sure.
They'll recommend, everything based on your own weight and kind of guide you through it.
Sure. Exactly. I mean, if there are any concerns that you may have as you progress through pregnancy, I think it's always a good idea to talk to your provider to see what their recommendations may be.
Yeah. How reliable is the BMI to determine those factors? Like if you're underweight or overweight, or is it...
It's a calculation, so it's accurate.
I mean, does it take in consideration like being small boned, or you know what I mean?
Sure, that's a great question. No, it does not, and that's the limitation of the BMI is it doesn't factor in muscle mass versus like you mentioned
like the
sleight
bone
of frame.
structure. But with both pregnancies, my OBGYN said you need to gain at least 35 pounds because you're underweight. And I actually gained, I think, 35 with my first, and it's not like I was trying to put on a bunch of weight or trying not to. I just kind of, I don't know, I just did. And I'm on the same track for this one, which is I'm at 25 right now, and I'm about the same track in which I'm pleased about because I had such a healthy baby. But, at the beginning of my pregnancy, she made such a big deal about, like, you're underweight. And I was like, but I'm really small bone. Like, if you look at my bone structure, I'm not anorexic. I eat.
That's really interesting.
It's like my bones are just small, and somebody who has like big bones that weighs more isn't necessarily overweight. I mean, you know what I mean?
Right, and that's the limitation to the BMI is that it's not absolutely accurate based on, like you said, muscle mass or a smaller, slighter frame person. It's mainly just general guidelines that we have to have somewhere to start, somewhere to go from.
I have a question. Where do you count the weight gain from? Because that's something that oftentimes, I'm trying to figure out how much weight have I gained? And the reason I ask this is I had a pretty rough first trimester. So I was actually down anywhere from 8 to 10 pounds by the time I actually started eating again and gaining weight. So my nutrition during the first trimester was horrible, but if I was even eating. But so I wonder, do I still count my weight gain from my pre-pregnancy weight, or is it from where I was at my lowest point, probably 13 weeks or 14 weeks into the pregnancy?
Sure. I think I would base weight gain on your initial visit, your pre-pregnancy weight. Unfortunately, nice. we do have patients who have a lot of issues with nausea and vomiting and not able to get the good calories in. In those patients, we want to encourage several different methods to kind of help get you back up to the ability to put on those pounds again.
I don't seem to have any problem now.
Yeah. Problem solved.
No, but it is kind of nice because for a while there, I'd sort of, I'd lost almost 10 pounds and then I gained 10 pounds. And to me, I was like, well, I'm exactly where I was, right. The day before I found out I was pregnant or the month before I found out I was pregnant. But I was like, but technically I haven't gained any weight. But then all of a sudden I had the stomach. So I feel like during that, maybe I lucked out because I think during those weeks I lost weight everywhere and then only gained it back at my belly and my boobs. So
right.
It worked out okay, but I've always been curious about that.
Yeah, and I look at the bigger picture rather than just staunch numbers. Yeah. And I always talk about that with my patients is that overall, if the little one's growing well, you're feeling good and everything's progressing like we'd imagine it should, then that's the most important thing to me.
Yeah, let's break down where this weight actually goes because a lot of women want to know, why do I have to gain so much weight? So let's talk about that a little bit. How many pounds usually go to, let's say, the baby?
The average fetus is between 7 and 8 pounds.
Okay.
There are a lot of different factors when it comes to weight gain as far as it's not all just in our fat stores. Fat stores makes up about 6 to 8 pounds total in a pregnancy. There's a vast increase in blood volume in pregnancy, and that increase equates to about 3 to 4 pounds total.
Okay.
As I can imagine a lot of pregnant women would tell you that you feel like their fluid volume is a little bit greater as well. And that can equate to about 2 to 3 pounds total.
And is that amniotic fluid that we're talking about, or?
No, just basically tissue.
Oh, okay.
Tissue, swelling and things like that. Amniotic fluid is about 2 pounds total.
Okay. What about the uterus? I know I can feel my uterus expanding. I'm going, okay, how big is this thing actually getting?
Sure. As the uterus gets bigger, hypertrophies, generally that's around 2 pounds as well.
Okay.
And we also have to account for breast enlargement as milk comes in, engorgement. That's about 1 to 3 pounds.
Okay.
And the placenta is about 1.5 pounds. So all those factor into total amount of weight gain.
Okay. Now, I have to ask a question because this comes up with every pregnancy. My mother and I discuss weight gain, and because you know how moms are, they want to make sure that you're looking good. And I feel like my mom's always been on my weight throughout life, but especially during pregnancy. When she was pregnant with me, she gained like 12 or 13 pounds, and it always comes back to that. And I have told her, Mom, I'm literally one of these women that gains 35 to 40 pounds in a pregnancy, and it's not that I'm totally well with this pregnancy. I do have gestational diabetes, so my diet has changed and I haven't gained quite as much weight, but I was pretty much eating the same stuff that I ate before pregnancy, but it wasn't like I was just like mud pies and Twinkies and cheeseburgers. Have these recommendations changed over the years for how much weight we should gain? Because my mom looks at 35 or 40 pounds and thinks that's way too much, and I look at 12 pounds going, based on what we just talked about with where, all these, the pounds go, whether it's amniotic fluid, the baby, the placenta, that seems really low to me. And we go back and forth every pregnancy on this. So what's your take on that?
I think that's definitely a generational thing. Weight gain and our recommendations for weight gain has changed significantly over time. In the 1930s, there was severe diet restriction and weight restriction. I think that about 15 pounds is what their general recommendation is, and we know now that for a normal body type person is too low. Even from 1990 to now, there's been different recommendations. So as we research more, learn more, just like in anything in medicine, there's changes that can be made.
Well, I have some numbers for you guys that might make you feel a little bit better. I got this from the internet, so you know that it's 100% true. It was some sort of celebrity website, but I thought this might make you guys feel a little bit better. All of you that are in my position where you're gaining 35 to 40 pounds. Kate Hudson gained 70 pounds with her first pregnancy. Jessica Alba gained 55 plus pounds, and she actually stopped counting at 8 months because she
didn't want to know the last.
I'm done counting. Kourtney Kardashian gained 40 pounds. Mila Jovovich gained 70 pounds. Heidi Klum always gains 40 to 45 pounds, she says. Giselle, which, the supermodel, gained 30 pounds. We're not going to count her. I'm just going to cross her off my list. Mariah Carey wouldn't say, but she had twins, and she's just said that she gained an enormous amount and she lost 70 pounds 3 months later. So
we know she gained at least 70 pounds.
Gained at least 70 pounds. And then Kendra Wilkinson gained 60 pounds. So when I read that online, I was like, okay.
I feel like they're all so tiny to begin with. They don't have an ounce of fat stored anywhere on their body, so they need to make up for it. That's why we could get away with only gaining 6 to 8 pounds of fat. They probably at 20 is just extra fat stored.
And it's one of those things you don't really want to talk about too much with people because speaking of celebrities, Jessica Simpson is getting slammed right now with saying what she's eating, and then how celebrities, because they're just in the media and people just want to hound them all the time, they are constantly taking photos of them and comparing them to their pre-pregnancy weight. And it's so unfair. But, I mean, if I have to hear one more time about, her eating Pop-Tarts with butter on them, I'm going to go crazy. Like, people obsess about it. So it's, when you're gaining weight and when you're going through this whole thing, sometimes you don't want to tell people too much because there's just so much judgment out there.
My pediatrician told us this week that his wife, who's like petite like me, her first pregnancy only gained 12 pounds because that's what they were told back in the day, which was, and they were making her feel really bad for gaining her weight.
Really?
And actually, she had a lot of health problems after because it was taken away from her bones and the calcium. She had some problems. And her second pregnancy, she gained 50. Which was good, I guess. But he said that for a while, the first 3 years, she was going back to the doctors over and over because she actually just hadn't gained enough.
Right.
And overall it was really doing a toll on her body.
Right. Yeah, so that would be my next question, Dr. Cobb, is what is the problem with gaining either too little or too much weight? Like, how does that affect mom and how does that affect the baby?
The biggest thing we think about with too much weight gain would be big babies. Big babies can lead to a little bit more difficult delivery, a little bit more difficult labors. From a standpoint of too little weight gain, we worry about growth restriction, babies not getting enough calories. And also there can be some developmental issues as well when there aren't enough calories and not enough weight gain.
Well, now we know how much weight gain is healthy for our bodies during pregnancy, but how do we achieve that goal, especially when food cravings and aversions take over? We'll be right back. All right, welcome back. We're talking with Dr. Cobb about pregnancy weight gain and what we should expect. So, Dr. Cobb, what are some simple tips to help mothers gain the right amount of weight during pregnancy?
Well, I think that calories are the single most important nutritional factor in determining birth weight. When we think about how much extra calorie intake do we need in pregnancy, it's really not an exorbitant amount in addition to your regular diet. It's only about 300 calories per day. Some tips to kind of help with that. I usually encourage my patients to continue with their generally what they're eating at this point. If we all know that 300 calories in addition is not a whole lot of extra food, an extra string cheese or something like that. So being cognizant of kind of what you're eating, making smart choices, overall healthy diet are some of the things I emphasize in pregnancy.
And I would imagine it's also where you get that 300 calories from. Like you gave an example, but it's, a venti frappuccino at Starbucks is an extra 300 plus calories. I'm sure that's certainly not going to be providing the nutrition. And so I think it's also about eating the right types of food and not just finding a way to just, fatten up an extra 300 calories. Now, is that 300 calories throughout the whole pregnancy, or does it change as you're in different trimesters? I know the baby's growing more in the third trimester versus the second. So do we want to make any adjustments at that point?
Sure. It's just slightly above the 300, probably another 100, 150 calories as we move further into the trimesters. In the first trimester, we're looking to gain 2 to 5 pounds. From that point on, second, third trimester, usually about a pound a week.
I'm curious. My weight gain's been very strange, and I'm obviously a little bit hypersensitive to it because I lost a lot of weight last year, and so it's always difficult, even though I know I'm pregnant, to jump on the scale and see the scale go up. But one of the things that I've noticed is I would be at the exact same weight week after week after week, 3 or 4 weeks at the exact same weight, and then all of a sudden one day I'm up 3, 4, 5 pounds, and then I would stay at that weight for a couple of weeks, and then a couple of weeks later it's the exact same thing versus this 1 pound per week that's steady. So if you average it out, I'm doing okay. It just seems kind of alarming that a month would go by, I wouldn't gain anything, and then all of a sudden, almost overnight, I'm 5 pounds heavier.
Yeah. And that can happen. Everyone's body makeup is a little bit different. Eating habits are a little bit different. That's why we look overall throughout pregnancy and weight gain. Most important things as well is when we talk about weight gain, we're talking about growth of little one as well, and how your health is overall. Like I mentioned before, I'm not absolutely staunch on a pound a week, things like it's just the overall health of you and little one and growth that's the most important.
How about food cravings and aversions? Like I know with my first, I eat chocolate every day at 4. That's just a routine I've had since I've been a child. And with my first pregnancy, I couldn't stand chocolate. It was just I don't know. My husband was like in awe. He couldn't believe it. But I craved a lot of like potatoes and strawberries and pretty much overall like healthy things. And now, of course, those are the things he likes. Spicy food I couldn't stand, and he doesn't like spicy food. This pregnancy round, the only thing I crave is chocolate, which is so different because
you're making up
with my first. Yeah, probably. But with my first, like I didn't have that, and it's like I had a lot of different cravings with my first, but with this one, that's like the only thing that I crave. And I'm wondering how cravings come into play, or aversions, like spicy food with my first, come into play with the baby. Or if it's nothing to do with it and just hormones.
No, I think, what I always tell my patients is listen to your body. I think that the female body has an innate ability to, take care of itself. And not only is that important in nutrition, but I always recommend that in labor and birth as well, listening to your body. When we talk about nutrition, I think your body has an innate ability to tell you what it needs or what it's missing. Cravings in moderation, I think, or anything in moderation is not a bad thing. When I talk to patients about specific cravings. I usually try to focus in on more natural ways to kind of curb some of those cravings in general, whether that be green teas, which not only is a great source of antioxidants, but decreases food cravings as well, and also trying to cut back on sugars, simple sugars and things like that aren't going to satisfy you, only increase those cravings.
So what do you do, though, if you're gaining too much weight during pregnancy? I know, some women want to put the reins on, or even, I don't want to say diet. Yeah, it's not the time to diet. You don't want to do that, but just kind of cut back, really start watching your calorie intake. Is that what you would recommend?
I never recommend losing weight in pregnancy. I think that it's important to continue with those calories for the growth of little ones. However, I think making smart choices, really analyzing what you're putting in and the calories that you're burning. One way is to increase the exercise that you're doing, whether that be walking an extra 15 minutes, but also making smarter choices, maybe pass up on a fast food and work towards more of a fruit or vegetable. Altering in that aspect is much more beneficial than trying to really restrict your calories.
Yeah, because sometimes you're just so hungry. You're like, come on, if I'm supposed to be listening to my body is saying, you better eat some more, girl. And what advice do you have for mothers out there who are constantly stressing about their weight during pregnancy? What would you say to them?
I would say to maybe look at the big picture. I usually encourage them to, while weight gain is important, it's not the only focus. And I think that when you get so focused in on that, I would not want you to miss out on the other great aspects of pregnancy in general, growing your little one and that bond that only you and that little one are going to have.
All right, good advice. Thanks, Dr. Cobb, for joining us today. This has been great information.
Thank you. It's a pleasure being here.
Well, if you want to learn more about Dr. Cobb and his services, simply check out the episodes page on our website and look for today's topic, which is pregnancy, weight gain, what to expect. Before we wrap up today's show, here are some great prenatal fitness tips.
Hello, Preggy Pals. I am Lisa Druxman, fitness expert and chief founding mom at Stroller Strides, a fitness program for moms and for babies. I'm here to answer some of your most common questions when it comes to exercise and pregnancy. Today, I'm going to answer about some of the benefits of exercise during pregnancy. You might think, okay, this is obvious. I know that it's good for me to exercise, but it's not only good for you to exercise during pregnancy, it's good for your baby to exercise. What are some of the things that you think about in terms of aches and pains and some of the discomforts of pregnancy? What if I told you that exercise can alleviate almost every single discomfort of pregnancy? The potential benefits of a well-designed prenatal exercise program are numerous, and I know you know that. I don't know if you know that pregnant women who exercise can maintain, but even increase their cardiovascular fitness, their muscular strength, and their flexibility during pregnancy. Research has shown that women who exercise during pregnancy experience fewer common prenatal discomforts, such as, all right, let's talk about them, constipation, swollen extremities, leg cramps, nausea, varicose veins, insomnia, fatigue. You guys, this list goes on and on. It also can assist in controlling gestational diabetes and prevent urinary incontinence. So if you have any doubt as to whether or not you should be exercising, check with your doctor. Make sure that it's safe. But I'm here to tell you that, yes, you should be exercising during your pregnancy. The benefits, you will be feeling better, you will have a better labor, and you will recuperate faster, and it will be so much easier for you to get back into your new fitness routine. So I look forward to seeing you exercising every single trimester of your pregnancy. Visit strollerstrides.com for more great information on how to stay fit throughout pregnancy and parenthood. And be sure to listen to Preggy Pals for more great prenatal fitness tips.
All right, that wraps up our show for today. If you have a pregnancy topic you'd like to suggest, we would love to hear it. Visit our website, preggypals.com, and send us an email through the contact link. If you have any questions about today's show or the topics we discussed, you can call our Preggy Pals hotline. That number is 619-866-4775, and we'll answer your question on an upcoming episode. Coming up next week, we're learning all about baby names. The co-founder of Nameberry.com and the author of several baby name books is our special guest expert. Thanks for listening to Preggy Pals, your pregnancy, your way.
This has been a New Mommy Media production. The information and material contained in this episode are presented for educational purposes only. Statements and opinions expressed in this episode are not necessarily those of New Mommy Media and should not be considered facts. While such information and materials are believed to be accurate, it is not intended to replace or substitute for professional medical advice or care, and should not be used for diagnosing or treating healthcare problem or disease or prescribing any medication. If you have questions or concerns regarding your physical or mental health or the health of your baby, please seek assistance from a qualified healthcare provider.
Hey mamas, don't forget to check out Mighty Moms. It's our online community built for new moms just like you. Not only can you connect with other moms, but you can also join us backstage for special mom-only online events. And you'll also be notified when we're recording so you can join us as a special guest. Visit our website, newmommymedia.com, and click on the Mighty Moms banner. It's free. That's newmommymedia.com. See you there.